Thank you, Dr. Shivakumar, and thank you, Murugs, for inviting me to speak today. It's great to be part of the Hair Research Society of India again. My topic today is oral minoxidil, the new kid on the block. So I'll be talking today about how oral minoxidil can be used for various hair disorders. So each time we see a person with hair conditions, it's always quite distressing. It's distressing for the patient and it's distressing for the doctor as well. But I think this medication may change the way we perceive these clinic appointments. It seems to be a really effective drug for hair disorders of almost any condition. So whatever the etiology is, this medication seems to be very effective. So let's look at minoxidil. Actually, they found that it lowered blood pressure. At that time, there was also this really difficult blood pressure patients, those who had very recalcitrant hypertension. So what happened was the FDA approved it for malignant hypertension. This was in the 1970s. And that's how it came into being as a medical drug first. They first started it as an antihypertensive. What happened then was it was authorized for use for 2 weeks. But because it was so effective in hypertension, they started using it for longer and longer period of time. And when they used it for longer periods of time, patients had a side effect. And the side effect was they were getting a lot of hairs. 60 to 80, they had found a drug which actually stimulates hair growth. They tried to cover it up. Upjohn really didn't want to market it as a hair stimulant. But this article changed everything. It came in the New England Journal of Medicine. This was in 1980. And if you look at the title of the article, it was Reversal of Baldness in Patients Receiving Minoxidil for Hypertension. This was in 1980 in the New England Journal of Medicine. And after this article came out, everybody wanted a piece of the action. Upjohn couldn't hide it anymore. In fact, after this article was published, Upjohn's landlines were completely frozen with phone calls because everybody wanted this drug for hair growth. And that's how actually it started. Upjohn then was acquired by Pfizer, and Pfizer started making minoxidil as a topical solution. And in 1987, it was first marketed for topical minoxidil. They started as 2% minoxidil, and then eventually they went up to 5% minoxidil solution and then minoxidil foam. And that was in the 1980s. Agents are compliance reduces. Oral medications, on the other hand, are usually used for long term without a problem, so it is more convenient. The second thing with topical minoxidil is when you apply it, you miss it on, for example, if you use topical minoxidil, it causes an irritant reaction sometimes, and it can also cause an allergic contact sensitivity, and that's again avoided with oral minoxidil. And finally, there is some evidence that it's actually slightly more efficacious than topical minoxidil. So these are the reasons why we use it. We also have to understand that it's a low dose, which not the doses which are used for hypertension. Hypertension doses are 10 to 40 milligrams, whilst for hair disorders, it is less than 5 milligrams. So the International Society of Hypertension describes that reducing blood pressure, it starts coming after the dose of 5 milligrams. So if you have it below the dose of 5 milligrams, you're avoiding that particular side effect. So most of the studies on hair conditions are quite a low dose. It's between 0.25 milligrams and 5 milligrams a day. Let's look at what oral minoxidil does for two parameters. What does it do for hair diameter and what does it do for hair density? And it seems to be effective in both. So as you increase the dose of oral minoxidil from 1 milligram up to 5 milligrams, for every 1 milligram that you increase it, the hair density increases by 1 micrometer, which is quite significant. And it's statistically quite significant, 0.03. The lesser the number, the more efficacious it is. Let's also look at what it does to, there's a study which shows that the hair density is increasing, and the reason it's looking more dense is because the diameter of the hairs itself is a lot bigger, and this came in an article just a couple of years ago. It also increases the density, and there are two densities we have to look at. What is the total hair density and what is the terminal hair density? Both of them are increased. The total hair density is increased by 47 hairs for every square centimeters. The terminal hair density, which is also important, is 9 new hairs for every centimeter. So these are highly significant numbers, and that's the reason why it looks thicker, the hair, and it gets even more thicker as you increase the dose from 1 milligram to 5 milligrams. That's another study which looked at the hair density, and all these things in green are the new hairs, and you can see there are significantly new hairs in the lower part compared to the upper part, and it's visible macroscopically as well. How does it work? There are quite a few ways by which it can work. It's an antihypertensive, so it dilates blood vessels. So if it dilates blood vessels, then more growth factors go into the hair follicle, therefore more hair grows. It also prolongs the anagen hair. Anagen hair is the growing hair. So if you increase the number of growing hairs, naturally you'll have thicker hair. It inhibits the androgen effect. One of the main reasons men lose hair is because the androgens cause miniaturization of the hair follicles, and this sort of disrupts that. It also has immunomodulatory action. It seems to decrease the immune function in the hairs, and that's why it's effective for lots of immune mediated disorders as well. The one thing to remember is that it takes quite a long time to work. It takes about 8 weeks and up to 4 months to work. So that's the reason why when you start this medication, you have to use it really for a minimum of 4 to 6 months. It's not going to work before that. Its effect starts occurring only after the 8th week to the 4th month. Let's look at a few specific conditions where we can use it. And as I said, there's a very broad range of conditions. Female pattern hair thinning is probably the most commonly used condition. There was a really big paper on this, 1,400 patients, Rodriguez Barata paper. And what they found was at a dose of 1 milligram per day, it did start increasing thickness of the hair. And it was more prominent if you have more advanced hair loss. So if you have much thinner hair and you use it, it seems to be much more prominent. In a paper in Australia, they combined it with spironolactone, and I think that's actually a very good combination. Spironolactone has anti-androgen effect, and minoxidil stimulates hair. So if you have both together, it is immensely effective in female pattern hair thinning. What about men? It works for androgenetic alopecia in men as well. The dose is slightly higher. You start at 2.5 milligrams, and 100% showed some benefit. And almost a half of them showed significant response. So all of these numbers are really very, very impressive. Another important factor is the longer you use it, the more improvement there is. So don't stop using it, keep pushing the dose, it gets more and more effective. One thing to note is that what's on the top, the vertex, seems to be much thicker. So that's where you notice the first response, and then the frontal hair response comes a little later. It's also used for other conditions. This is alopecia areata. If you look at alopecia areata, what it does is in this series of 24 patients, it reduces the recurrence of alopecia areata. It was a very clever study. There's 16 patients, and they used very low doses, just 0.25 to 2.5 milligrams. You know that alopecia areata is an immunological condition, and generally it can come back. But when they used oral minoxidil, the reduction was a lot less. Anticipated recurrence was 54%. But once you use oral minoxidil, it came down to 17%. So very, very impressive numbers in immunological reasons for hair loss as well. Chronic telogen effluvium, another very common condition we see. We see a lot of young women coming with hair loss, shedding of hair. And again, oral minoxidil seems to be very impressive in this condition. Doses, again, very lower dose than for men, 0.25 to 2.5 milligrams. And the hair shedding reduced by 86%. So highly, highly significant numbers in hair growth. It is used for other rarer conditions as well. So even if you have non-scarring alopecia due to loose anagen hair syndrome, monolithics, chemotherapy-induced alopecia, or traction alopecia, it seems to be effective as well. It's also used for scarring alopecia. This was one thing which surprised me. I thought it will work only for non-scarring alopecia. But even in scarring alopecia, what it does is it thickens the existing hairs. So it sort of camouflages the scarring. And in the mechanism, I told you that it has some immunological reaction. So it does seem to have an immunomodulatory reaction as well. So 2 reasons why it works even for scarring alopecia. Like in planopilaris is probably the commonest things we see, but also central centrifugal cicatricial alopecia and frontal fibrosing alopecia, which is incredibly common in the UK. In lichen planopilaris, it's effective for localized and generalized lichen planopilaris. And as I said, it seems to thicken the unaffected hairs. So therefore, if you look at the hair density in general, which I'll show in the next slide, it seems to be a lot more improved. You have to use it with the other anti-inflammatory agents. So if you're treating lichen planopilaris, you treat that, and on top of that you give oral minoxidil. That's the way it works the best. So this was a paper which looked at the hair thickness in lichen planopilaris, and very impressive. This was a 42-year-old gentleman with lichen planopilaris. He was on antimalarials, and when they added oral minoxidil, you can clearly see that there is significant improvement of the hair thinning in spite of him having the scarring. So even through the scarring, you can see the increase in the hair density. What are the adverse effects? We do need to be wary of what it can do to you as a side effect. And the most common side effect is actually this very fine hair growth, which usually occurs on the face. It's actually not a major problem for men, because for men it'll look like they're having just a bit of a thicker beard. But for women it may be prominent. But what I've noticed in practice and also from the literature is that the hairs are so fine that usually women don't mind it that much. And it's not that much of a problem, and I'll show you the statistics with it. It lowers the blood pressure, but it's very, very low number. And it can also cause some peripheral edema, but it's again very, very minimal. If you look at hypertrichosis or increased hair growth, each 1 milligram that you go up, that's when the hypertrichosis increases as well. So if you go up from 1 milligram to 5 milligrams, for every 1 milligram, the hypertrichosis increases by about 10 to 15%. So by the time to come up to 5 milligrams, about 50% of people will have some form of hypertrichosis. At 1 milligram, it's less than 10%. So if you push it harder, it will work, but it will also give you more hypertrichosis. So it's more likely with increasing doses, and as I said, up to 55% if you go up to 5 milligrams a day. But most are usually not concerned. They're very fine vellus hairs, so people can't really see it that clearly. And it is reversible. If you stop it or bring down the dose, it's not a problem at all. Just keep in mind, the dose you will give for most women is 1.4 milligrams, so they are never going to have this problem. The average dose for men is about 4 milligrams. Again, it's a lot less at 4 milligrams compared to 5 milligrams. What about this treatment? You try and use the lowest dose possible, and then you can use simple hair removal techniques. You can pluck the hair, shave the hair, wax it, or lasers, and therefore it's not a big issue with hypertrichosis. What about the cardiovascular side effects? What can it do to you? It can reduce your blood pressure. It's very minimal. It can cause peripheral edema, increased heart rate or palpitations, and abnormal ECG, but these are incredibly rare, less than 2 to 3%. And it also takes time. If you look at when it occurs, if you have tachycardia, it's within the first day. If you have lightheadedness, it happens in the first week. If you get headache, again, it's because of vasodilation. It's in the first 2 or 3 weeks. And then the fluid retention and hypertrichosis occurs a lot later. It's only about 3 months later. But again, that's rare. All of these are 1 to 2% of those who take it. So it's actually very, very unlikely that you will get it. And you're getting cardiovascular side effects for those with abnormal renal function or heart problems. These are the people who use it for hypertension in doses of 10 milligrams. So when we use it in dermatology, we're using it for young people who want more hair. They are going to be fit. So they are not going to have these cardiovascular side effects. What can you do to alleviate the side effects? Quite simple things. Firstly, try and take the medication at bedtime. So if you're going to have a low blood pressure and you're going to go to sleep, you're not going to feel it. So having a low blood pressure is not a problem if you're going to be sleeping a couple of hours after you're going to take it. Secondly, it can cause a bit of orthostatic hypertension. So after you take it, maybe advise patients for the next couple of hours to sit up slowly or get up slowly, because otherwise their blood pressure comes down very suddenly. In very severe cases of edema, maybe you'll have to ask them to limit their salt intake. For tachycardia or heartbeats, then you can use beta blockers. And for headaches, it's just the usual paracetamol and ibuprofen. So using all this information, what doses can we use for men and for women? So first, for women, they say that start at a dose of 0.5 milligrams a day and then increase it by 0.25 milligrams every 3 months. and the maximum dose is 2.5 milligrams. I actually try to start it a bit higher. I follow the Bharata case series, and they started at 1 milligram. So I usually start at 1.25 milligrams, which I think is the right dose for women. Usually within 3 months there is effect, and if it doesn't work at 1.25, you give 2.5 milligrams. For men, you start a bit higher. You start at 2.5 milligrams, and then you increase by 1.25 every 3 months. So this involves splitting the tablet. So I always ask my patients to get pill cutters. So you take one 2.5 milligram tablet, then you cut one and take 3.75 milligrams for 3 months, and then you go to 5 milligrams after 3 months. The maximum dose is 5 milligrams. By 6 months, you will know if it's going to work or not. And in most people, I feel that there is some improvement of hair. So treat for at least 6 months, and if it works, you do have to continue with it indefinitely. And it does have effects, because as we get older, we are going to get hypertension anyway. So if it's going to lower your blood pressure, it has beneficial effects for that too. So what are the take-home points? What are the things I've learned from using this medication over the last year? So firstly, there is hair growth, and it is dose dependent. You give a higher dose, you get a better response. It also increases hair density and diameter, and that is also the dose dependent. Side effects are also higher with higher doses, but that you can optimize by using the other strategies I've told you. The hypertrichosis and cardiovascular side effects, I've mentioned to you how we can alleviate those. Generally, it's very well tolerated. I've had very little problems with it in the last 12 to 18 months that I've used it. And the reason why it's more effective is because topicals generally are more difficult to use. We are not going to comply with it, and there are these other problems like irritant or contact dermatitis coming up. So those, as I said, 0.5 to 2.5 milligrams in women, and 1.25 to 5 milligrams per day in men. So the 5 C's are what you need to remember. Why is it so useful? It's convenient, you get good cosmesis, it's comfortable, it's cost effective, and most people are compliant. So the 5 C's of oral minoxidil, and this was mentioned in one of the review articles on oral minoxidil. And finally, I've done a couple of talks on these already. I'm sure many of you would have seen it. So I usually, whenever I prescribe this drug to my patients, I ask them to see this, because I've detailed the dosage and the side effects, and I also tell them what they can use it for, and I think they find it incredibly useful, particularly in private practice. Thank you. Any questions? Oh, no, okay, sir. Yes, please.
Thank you very much for the excellent talk, and I think this particular product, I think I'm really attracted. Just want to ask one question, because we have already using topical minoxidil in so many patients. So I have come across there is a blood pressure fluctuation and hair growth in the face. This is a common, about teenage girls, college girls, which blackouts and fluctuation in the blood pressure. So those who are already on topical minoxidil, would you like to suggest to go ahead with the tablet?
No, I try to dovetail it. I think using both probably isn't the best combination. So I tell them the problem with all these minoxidil products is there is a phase when you get some hair loss, you go into catagen phase, and therefore you lose a few hairs for the first 3 months. So for the first 3 months, I ask them to overlap it. They'll use topical minoxidil, they'll gradually introduce oral minoxidil, and as the oral minoxidil kicks in after 3 months, I ask them to stop topical minoxidil and continue only with oral, and that seems to work quite well. Trying to use both long term, I think, is difficult, and as you said, probably has more side effects too. So I don't think there are any studies, this is just a personal observation in my practice.
How to handle the blood pressure fluctuation?
I should admit,
a little bit scared of blackouts and all.
If I ask my patients to take it in the evening or night, the tablet, it doesn't seem to be a major issue. I mean, I've not had any patients who've had blackouts, and I start reasonably low. If 1 milligram I think is a reasonable dose, you don't get blackouts at that point. I think as you come closer to 5, which is unusual for women, it's more common for men, Men don't get blackouts anywhere. Women, if you go above 2.5, you may get blackouts. Yes. Many people, particularly for scarring alopecias now, as soon as I start an anti-inflammatory drug, I start them on minoxidil as well, particularly in the last 12 months. Since I've read these papers, I've changed my practice. I use this with my anti-inflammatory drugs, and I tell them the rationale as well. I want to take away the inflammatory changes with the anti-inflammatory drugs, but I want to thicken the existing hairs with oral minoxidil, and I think it's a good combination. Okay.
Thank you.
Thank you.
Dr.